For the upper limb examination, what you have to know is that you should always do the limb examination with the mnemonics of look, feel, and move. And when doing with these mnemonics, you should always examine, taking in consideration of the major structural part of the limb. The major structural part of the limb are: the first, you have the muscles; second, you have the nerve; you have the arterial, the blood supply; you have the bones. So I'm going to start with the examination, and lastly, you have also the lymphatics. I'm going to start with the examination of the gross morphology. For the examination of the gross morphology with the bones, you have to measure the limb length. For the limb length, you have to use reference point. Here is the acromion of the scapula. You start from the acromion of the scapula, and then you measure. You can use one distance from the acromion of the scapula in order to the olecranum of the ulna. So when you measure as such, you have to calculate the distance and then you compare on both sides. You can have small discrepancy of about 1 centimeter, but if you have a discrepancy of more than 1 centimeter, it means that there's a pathology of the bones. Now, the next bone you can evaluate. You can also evaluate the distance between the acromion till the ulnar steroid process or the radial steroid process. So you have to measure distance and compare on both sides. That is to tell you the gross morphology of the bone. The next thing is palpation. You have to palpate at the level of the arm, you palpate at the level of the forearm, you palpate at the level of the hand to find if there is any tenderness. Now, the next thing, that is for the evaluation of the bone. Generally, that's how we evaluate the bone. The next thing you have to evaluate is to evaluate now for the muscles. To evaluate for the muscles, you have to use the next one, which is move. You ask the patient to flex the arm. Please, can you flex your arm? When you flex the arm bone, you evaluate the muscle of the anterior compartment of the arm. Ask him to extend the arm. Please, can you extend? You evaluate the muscles of the posterior compartment of the arm if there is any abnormality. Ask him to pronate. Can you do it? This is pronation. You evaluate for the pronators in the anterior compartment of the forearm. Can you supinate? Supination. You evaluate for the supinators in the posterior compartment of the arm. Ask him to flex at the level of the wrist. When you flex at the level of the wrist, you have evaluation of the muscles of the anterior compartment of the arm, the flex of the anterior compartment. And lastly, you ask him to flex at the level of the hand, abduct at the level of the hand, and do other motion. Please produce a fist. So all these are evaluation of the muscles of the anterior compartment of the hand. So that is generally how we do evaluation of the muscles. So if you have any abnormality in one of the motions that I just mentioned, it means that there's an abnormality of the muscles in that compartment or the tendon in that compartment. The next evaluation that you have to see is then that you have to evaluate now for the tendon abnormality, tendon rupture. Now, if you want to visualize a tendon rupture, generally it is just an extension of the Simon test. It's called the ScHRDB test. You need to know that generally when you compress a muscle compartment, just come closer. Generally, when you compress a muscle compartment, you are going to have the action of that muscle compartment. It's just an extension of the Simon test that I'm going to show you later. So let's see. You see, I compress here. I have a slight flexion at the level of the hand. I compress, I have a flexion, compress, I have a flexion, compress, I have a flexion. That's a normal finding you should have in a compartment. So in the flexor compartment, when I compress here, I have a slight flexion. If you don't have a flexion, it means that there is a tendon rupture. The best way to see it is to use the Simon test. Please, can you turn to the back? So to evaluate the Simon test, what you have to do is that you look at this position and you are going to press the calf muscle. So look very well. You see, when I press the calf muscle, is flexing at the level of the Achilles tendon. It means that there's a normal tibial morphology. But in the case of a tendon rupture, that's Achilles tendon rupture, we are going to have a Simmons positive test where we are not going to have the contraction of that muscle. So this is not going to flex. So that is the evaluation of the muscles and tendon. The next aspect of your limb evaluation is to evaluate now for the arteries and the arterial supply. To evaluate for the arterial supply, you need to know the different landmarks of the major arterial bundles. Here is the brachialis artery. For the brachial artery, it's located